All right, we're ready to start. Thank you so much for joining this day 2 Learning Lab sessions on economic evaluation of multisectoral projects. We had an astonishing Learning Lab, I think, from Purnima Menon, the masterclass just now, and we'll do our best to rise to her high standards in an area that's been just extremely thorny, very, very difficult, and a great champion for this kind of work has been Carol Levin, who I've had the privilege of working with in this ANH Academy technical working group on this topic. I hope you've all seen the technical working group brief that is out on the publication table. It's the result of the collaboration between people that Carol has worked with for a very long time and a bunch of newcomers from different fields, and a lot of hard work over the last 18 months, basically, to produce the technical brief that Carol and I've contributed to distilling into this Learning Lab. So she'll be driving for almost the entire time. We're going to have some individual reflection and work in pairs before lunch, and then they'll bring in tables for us to have somewhat larger group discussions after lunch. So in the after lunch session, we'll make those tables around groups of people who you typically won't know the other people. They'll be coming from different fields, different sectors, and that's kind of the point of this, this type of work. For now, we will have an exercise that involves using a laptop to go online. So if you did not bring a laptop, can you just sit next to someone who did? Okay, so just check with your neighbor. In addition, we're going to have a little exercise of talking to your neighbor. So you want to be in pairs with at least one of you having a laptop. Does that make sense? So just make sure you could talk to a neighbor who has a laptop. So you might want to, if you're alone, you might want to move.
Or you don't need the laptop for talking.
Oh, right. Yes, that's true too.
You can actually, or you can use, social media to talk to your neighbor.
Yeah, you can use you could do it with a phone, actually, for the.
Oh, yeah, you could. Can you? Just a text on the phone?
Yeah, you can. The browser. Okay, so if you're ready to go.
So we were going to do an icebreaker this morning. Good morning, everyone. But we'll do our icebreaker actually in the afternoon. That'll help liven us up after lunch. So thank you, Will, for the introduction. I do want to point out that we will be recognizing all of the folks of the AHN working group at the end of the talk, but Jan Lowe is here, who also was a contributor to this, to the brief, and I hope many of you have had a chance to at least flip through it. We are going to, in the afternoon, we are going to have some hands-on work, so I hope you'll all come back and get ready to roll up your sleeves and do a little work. I think that helps to bring some concrete experience to what we'll be talking about today. So welcome, everyone. Before I start, how many of you have ever taken a class in economics, economic evaluation? Raise your hand. How many of you know have ever studied what a cost-effectiveness or cost-benefit analysis is? Raise your hand. Okay, I'm going to stand here. I remember this thing is short. Okay, and all right, and how many of you know what a DALI is? Raise your hand. Okay, so I'm talking to a pretty educated group, which is good for me, and so maybe I'll be able to kind of move through some of my slides a little sooner. I'm not going to go verbatim over the policy brief. Why? Because you have it handy. What I'd like to do is sort of take a step back and lead us to, by the time we finish this morning session, get us to a place where we all agree and understand the need for a more standardized approach to understand costs and benefits associated with multisectoral nutrition strategies. And I want to say two things about Purnima's talk. Well, one, you might have noticed she had a metal bottle, and I'm drinking out of plastic, so that should give you an indication, I don't know, sort of the quality of today's talk. Just kidding. And the second is, I thought it was really interesting that some of the lessons learned are very relevant to what we're doing here. One of them is high-quality research and working towards standardization and transparency. And that's our goal. There's nothing new here in the field of economic evaluation. What we hope is new is that those of us interested in conducting cost-effectiveness analysis, or cost-benefit analyses of our work will move toward standard language, simple language, and high-quality research that is understandable by everybody and transferable. So that's one of our goals. The other thing that Purnima said, what I think this group has done, this technical working group in which we hope to continue to do, is can we create a window of opportunity? And we've seen that in the field of nutrition, in fact, this has happened. Can we now create a window of opportunity to strengthen the application of economic evaluation to multisectoral nutrition strategies? And I know many of us struggle with capturing all of the benefits associated with multisectoral strategies. And so we don't have all of the answers, but we're asking the questions. So with that, let me go ahead and get started. For our learning objectives, I'm not going to repeat these. Hopefully you read them before you came, but they are here when we share the slides. You'll be able to come back and see if this actually happened. Let me figure out how to work this. Does anyone know? Will, how does this, okay, got it. All right. So what I'd like to do as a warm-up to what we're doing is we're going to answer the following questions. What are we evaluating exactly? You know, people talk about cost effectiveness, cost benefit, but we really sometimes have different things in our heads. How is economic evaluation defined? Again, sometimes we have different things in our head, what that means. What are different types of economic evaluation? That one's fairly straightforward for me, but we try to give a nice summary of that. What are the uses of economic evaluation? How can policymakers use economic evaluation? And how do you know something is cost effective, right? Or in the case of benefit cost analysis. So, oops, going the wrong way. All right, so first, what are we evaluating? We're typically evaluating an intervention or a set of interventions. In global health field, we're often evaluating a technology, a diagnostic, a drug, or a vaccine, and delivering that to the beneficiary. In multisectoral strategies, we're looking at a combination of interventions more often than not, some that are related to the supply of nutritious foods or the demand for that, increasing the demand for that. We're often looking at policies, and policies are different than interventions, and sometimes people use the same word. They say policy when they mean an intervention. A policy might be a food policy. It might be a government's decision to reduce sodium in sodium levels, acceptable sodium levels in highly processed foods, as in South Africa. It might be taxing sugar-sweetened beverages. But we're looking at both, and so it's important to be very clear. So to my point about policies and interventions, typically, and we heard about this today, decision makers, depending on who you're thinking about, if it's perhaps a donor with a single objective in mind, maybe they are simply thinking about vitamin A capsule distribution. But a government that has to think about allocating its resources is thinking about a package of policies. So it's not just a single intervention. Often what we're doing as researchers, though, is we are focused on one. But we have to remember our information has to feed into that broader decision-making process. What's sort of new in economic evaluation is starting to think about the platform, right? So what is the platform? And I think many of us talk about service delivery or the delivery strategy. And that can affect your costs and benefits in the sense that the platform may affect your reach or coverage, and it certainly will affect your costs. And so the different things we tend to think about now are things that are being designed and delivered to households or to communities or through health facilities or through school-based strategies. And then I've already mentioned the various different types of policies. So those are the kinds of things that can be incorporated into what we're doing. How is economic evaluation defined? And I think for non-economists or non-specialists, people that don't do this work, one of the most common mistakes is thinking about cost effectiveness for a single intervention, not compared to anything. It must be a comparative analysis, right? And we'll talk about why that is. But it's typically a comparison of two or more alternative health, and this was written for, health or agriculture or combined interventions, right? So we're we're comparing two programs in terms of their costs and effectiveness. And effectiveness will be measured in the same unit, and we'll talk about that in a minute. So what costs refer to the value of resources that are involved in providing that treatment or intervention, and benefits and consequences are a range of benefits or health outcomes, health or nutrition or economic outcomes of the intervention. Pretty straightforward. So here are the types of interventions that we're talking about under economic evaluation. One is a cost-consequence analysis, and that's actually a partial economic evaluation in the sense that we're looking at a lot of different consequences associated with an intervention, and we'll talk a bit more about that later in the afternoon, but it's really just disaggregating your costs and benefits, and we'll show you how we think about doing that along a program impact pathway for multisectoral nutrition strategies. Cost minimization is just, again, a partial analysis where you're looking at how to minimize costs for reaching the same outcome. Cost effectiveness analysis, this is what maybe most of you are familiar with. This is when we're looking at the costs associated with a change in a health outcome, or a case averted, a death averted, it could be a case of stunting averted, it could be vitamin A deficiency averted, a case of vitamin A deficiency averted. It's a single health outcome. Cost utility analysis, on the other hand, is when is looking at a cost per DALY or quality averted, where the DALY or quality is a health index. So what does that allow you to do? It allows you to now, instead of looking at one outcome, look at multiple outcomes associated with averting that nutrition or health consequence. So you can combine mortality and morbidity in a single unit. And so all of these, the numerators so far have been costs, right? Cost is in the top of this equation. And what's changing is the denominator, right? So we're looking at costs over some kind of outcome. And so the outcome measurement is changing. When we get to cost-benefit analysis, this is a method that hasn't really been used a lot in health. It's been used a lot more in agricultural investments. It's been used a lot in water, sanitation, and hygiene, but it hasn't been used in pure nutrition or health interventions. And the reason why is many of us in global health and nutrition don't feel very comfortable with assigning a value to a human life or death averted. So there's been a little bit of a challenge getting over that hump of what we call valuing a statistical life. There are some challenges with that. But that's a cost-benefit analysis, converts everything into dollar terms, and it presents you with a return on investment, or it presents you with a ratio, and you want that ratio to be greater than 1. All right? So those are our type of economic evaluations, and I'm assuming that none of these are a surprise to folks, I'm hoping, okay? So just kind of breaking it down, just one more step, and really for global health and in our technical brief, these references are all there. They're important references. Drummond and all from University of York, they have third or fourth edition of how to conduct an economic evaluation in health, and a lot of those principles are very important for the work we're doing. But basically, we're really looking at the, we have choices of intervention A, the old, whatever we used to do, could be nothing, to a new intervention B, and we have to understand both the consequences and the costs and consequences associated with those two choices. So just trying to hone in on that simple analysis. And the whole point of what we're doing really is to start to understand the trade-offs in costs and health or nutrition outcomes, right? What are we really doing here? It's not sufficient to just measure the efficacy or effectiveness of a strategy, a program, or an intervention. It's necessary, but it's not sufficient. We need to understand the resources associated with those gains in nutrition or health, right? And so that means that we have to think, you know, economists are really obsessed with understanding sort of efficiency, economic efficiency. How do you get the most output at the least cost, or the best health outcome at the lowest cost, or allocative efficiency in society, which means from a societal perspective, we're allocating resources to maximize social welfare, right? So those are big areas that economic evaluation can address: economic efficiency and allocative efficiency. And we care about choosing, taking into consideration those interventions where the benefits outweigh the opportunity cost. How many of you are familiar with the concept of an opportunity cost? So just for those of you that aren't, you're sitting here right now, your time is in this room. You could be elsewhere. You could be in that nice restaurant having a meal, all right? So the opportunity cost of your time is maybe the meal you're giving up, or if you could be working, it's the salary that you could be giving up, right? So all resources have value, and if they're being used for one purpose, they are not available for another, all right? And so we care about allocating those efficiently. In agriculture in low and middle income countries, in global health, the markets don't work, right? Typically, we rely on markets to do that efficiency for us, to maximize efficiency. But the markets are imperfect in global health, for sure. We underinvest in our health and nutrition. And in agriculture, we actually don't have perfect information. Not all farmers can instantaneously know the prices of farm gate prices or retail prices. So in these environments, we need to be thinking about other methods for allocating scarce resources. So let's do any questions just before I go on? This is sort of just some basic stuff on economic evaluation. The take-home message is really needs to be comparative. You need to be considering whether or not the costs outweigh the benefits. Any questions? Great. So let's do a 2-minute exercise, because most of you are kind of familiar with this. Find a neighbor. It's going to be 2 minutes for each of you, so it's going to actually be 4 minutes. And what I'd like you to do is, for one, maybe interact, let one person start the conversation. Perhaps you want to start with the second bullet. Have you ever actually used the information in cost or cost effectiveness or cost benefit in your own work? Yes or no? Have you used it? If so, how did you use it? And then the top bullet is, how is it generally used? Has it been used? Or are you familiar with how this information has been used? And then think about key criteria for decision making in your own environment. So why don't we, I'll go ahead and get my phone out, and if you can find a neighbor, just take a couple, 5 minutes to have these conversations. Has everybody had a chance to talk? It's 2 minutes. All right, so 2 more minutes. So if you haven't switched, you ladies over there, I am calling you out. Just kidding. How many people have had both opportunity to talk? Okay, we'll wait a couple more minutes.
in an earlier program, not the one, we used the list mode. Life save in childhood diarrhea control.
So I feel that maybe similar to what we are discussing. Maybe you don't know the technical imaginary in you, but it looks to me that they might be similar to
People are just guessing.
Okay. What I'd like to do is ask a few people to, if you can wrap up your conversation, if there's a couple people that would like to share their experience and just what did you take away from how information is used? How is this information been used in your own experience? Any volunteers to, hands up if anyone wants to share with, okay?
Hello, everyone. As part of my master's project, I did a cost-benefit analysis. It's an agricultural cost-benefit analysis in Bangladesh, where I looked at agricultural machinery to see if that has benefits for the farmers. And so we did it for like 3 machines, 2 types of harvesters for rice and 1 type of dryers. So I personally did the cost part where I had to look up for articles to see how much they spend on the inputs and labor and all that. And we had information from the machinery sector as for the hiring charges for the machinery and yeah, so we did the cost benefit analysis and we found that there's some money, there's some benefits by using the machinery, but we couldn't exactly attribute the benefit to the farmers. We weren't sure if it was going to the service providers who provided the machinery or if the farmers actually profited from it.
Thank you.
Yeah. Thanks.
Yeah, Kenda. So if you can talk about how the information is being used for decision making as well.
Yeah, so question 1, how the information is used. I think donors often have a general sense of how much particular types of interventions cost. Don't ask me where they get this information. And that is sometimes used in their design of an RFA for the types of programs they want implemented. And if they expect you to reach X number of individuals with your intervention, they multiply the cost that they think the intervention should be by that number of people in target setting and budget allocation for the programs.
Thank you. So what Kenda just described to us was a cost analysis, not necessarily cost effectiveness or cost benefit. Thanks.
Hello, I'm Hayan, and I'm an economist, and I moved out of nutrition research, and I'm now working in a debt management office. And for us, the critical question is, if we take on debt, will it refinance itself? Will we have the benefits? And my key interest here is, can we frame nutrition interventions as an investment project? Like we build a bridge and we'd get the money back.
Yes, you can. Any comment from this side of the room?
Thank you very much. My name is Miriam Matita. I've done some evaluation of the Malawi Farm Input Subsidy Program, and we found that on average, the program benefited the country overall, that we were able to get enough maize as a country. But households were not directly benefiting from the program. And that information has been used to some extent by policymakers. For example, we have seen an increase in the farmer contribution in the program from Malawi Kwacha 500 to about 3,500. So the farmers are now contributing more because the program is expensive for the country to run. But besides that, I think what supersedes the decision of the policymakers sometimes is political. They want to maximize the votes that they can get because it's a program that targets many farmers, about a million. So they want to maximize the votes, not necessarily looking at the cost benefits of the program. Thank you.
Thank you. So, okay, I guess I better put that there. So that's great. Your responses highlight a couple of very important things, which are there are many criteria that go into decision making, and cost effectiveness is just one of them. And interestingly, looking at cost benefit analysis and finding different results that can help you tweak the program. So your own experiences help you to think about some of the ways. So let me kind of more formally tell you why those of us that do this as well. One, we are typically guiding decision makers, and we heard about that term, right? So as you can see, I had this slide as policymakers last night, and I changed it to decision makers. Yes, I'm already following Purnima's advice. And so there are a lot of different decision makers, and they're trying to make a decision about whether and when to change an intervention, right? And so, it's really often thinking about introducing something new, scaling it up, and it could be something like, do I, is there a return on investment for the debt, a debt program? Should I be supporting food-based strategies or vitamin A capsule supplementation? Should it be an outreach program or a facility-based program? There are many different questions and levels at which decision makers need information. And so, how program planners and policymakers use this information. They need clear evidence. They don't always act on it. So we just heard the example of often political will is stronger than what the evidence tells you. Estimates of cost effectiveness, and cost-benefit analysis have to be clear, right? So the effectiveness targets must be clear. The budget constraint must be clear. This isn't always the case. And then having information on a threshold for what is considered cost-effective or not has to be clear. And so the reality is sometimes none of these things is very clear, and people are making decisions, program planners, policymakers are making these decisions. And so, for instance, poorer countries spend very little annually on per capita health, and so it might be that they can be moving resources around that could maximize their health gains if they thought about reallocating resources. So what is the actual decision in economic evaluation? All right, so this is called the cost effectiveness plane. How many of you have seen this diagram ever? Wow, okay. So this is really what it's all about. And it's about generating evidence so that we know whether so if we're comparing intervention A, which is old or the status quo, with intervention B, which is something new, an intervention, a set of interventions, a policy change, we want to understand, we can map our results in terms of 4 quadrants, right? It's either costs more, or it has, the upper arrow is costs a lot. As you go down, it has a lower cost. Do we have a pointer on this? Okay. The middle top, okay? Okay. And then we look at effectiveness from low to high. Typically, the northwest quadrant and the southeast quadrant for us are no-brainers. If something is less costly and more effective, we're going to do that. If it's more costly and less effective, we're not going to do that. But where the real decision lies for most of us is here. That northeast quadrant is usually what we're talking about. There is nothing in the short run that is less costly and more efficient, right? Everything we do requires some infusion of resources. And so maybe in the long run, we're driving those costs down, but we often have to think about this. A neglected area, and there's been some work done on this, and this is really interesting, and we don't have time to go into it today, is what we call the southwest quadrant. B is less costly, but it's not as effective. Sometimes that may be the right way to go in some settings, all right? Highly cost-constrained, you may have a collection of interventions that are a little bit less effective, but less costly. So these are the this is how evidence should be used and how we need to learn to present that information to decision makers to help them consider the evidence that we're generating, right? And we heard about sometimes being an honest broker or being an advocate. And what we often see is economic evaluation being used mostly for advocacy and not for helping inform decisions. So again, I mentioned to you the Northeast quadrant is typically where we live in cost effectiveness analysis. Just to use that as an example, we're often dealing with incremental costs. Why? Because we're comparing the average cost of a new intervention to what's going on. That difference is an incremental cost to the existing system. We're comparing it to the net gain in benefits. So the mean outcome of the new intervention minus the mean outcome of the old. That is the fundamental incremental cost effectiveness analysis ratio, all right? You'll often see an average cost effectiveness ratio out there. Just the total cost of an intervention divided by the number of maybe cases averted. There's nothing wrong with that, but it isn't going to help you make a choice, a trade-off between resources. So incremental cost effectiveness ratios, I mentioned to you, how do you know if something is cost effective? That's tricky. So up until maybe a year or two ago, the World Health Organization in their macroeconomics and global health came out with if something is less than if the cost of an intervention, the cost per DALY averted, is less than 3 times the GDP, it is cost effective. If it's less than the GDP, it's very cost effective, average GDP per capita. Well, people were looking for a threshold to hang on to, so everybody grabbed that. A lot of us researchers are like, oh yeah, mine falls under that, that's great. So we're like, it's cost effective, yay. But the reality is that threshold, just about everything in global health is cost effective. There's very little that doesn't fall under that threshold of average of a GDP per capita per day. Now, some integrated agriculture, health, nutrition activities actually aren't falling under that. Why? Because they take a lot of resources from across sectors. There's other, so one method is a threshold. The other is a benchmark. That would be that you use some sort of thing. You say, well, anything under $50 per disability-adjusted life year, or per case averted, or per death averted is cost effective. But that's pretty arbitrary. And for many of the interventions we're interested in, there is no benchmark. We don't even know what it costs per case averted or death averted or nutrition outcome improved. And the final one that's used in global health is, and can be used, and we'll be getting some exposure to that, is what's called the league table. And basically what you do is you take all the information you can on cost effectiveness from systematic reviews, and you order it from highest to lowest, or from lowest to highest, and that's called the league table. And you would naturally start with the thing that is the cheapest for a disability-adjusted life year. So if something is $25 per disability-adjusted life year, I'm going to provide that to my population. And you rank it all the way down to the end. So league tables have their own challenges. None of these talk about affordability, by the way. And that's why understanding costs of us introducing and scaling up your interventions is important. None of these tell you anything really about affordability. They're just telling you if it's good value for money. Okay, so I wanted to just sort of talk about that third question, which was what are the various things, the criteria that decision makers take into consideration. And I just want to highlight that cost effectiveness truly, truly is just one of them. Political will needs to be up here because, in fact, that's often the one that drives decisions. But it's really understanding that burden of disease. If something is cost effective, but it wouldn't be if you had a low burden of disease, but you'd be surprised that some people can make a case for that, and it's like, but this is a low burden of disease in the country. Should we be spending scarce resources for this? And I think many of you are familiar with some of these other, areas. So I thought it would be useful very quickly to sort of show how the different types of economic analyses have been used for nutrition policies to date. And I'll go through this quickly, but, and I think many of you will be familiar with this. So first of all, which nutrition interventions? And to date, the bulk of the information has actually been on what we call nutrition-specific interventions, those interventions that have been shown to be effective and cost-effective in the Lancet series. Most of the work to date has been on that set of interventions. So again, that's the interventions that are working at this upper level, not so much at those that are getting to the underlying causes, all right? So really more focusing on immediate causes, but not so much information on those underlying causes. So here's just a kind of summary of how I showed you that we have cost-benefit analyses, we have cost-effective analyses, we have cost analyses, and one can imagine sort of a triangle, an upside-down triangle, where at the very beginning you might be looking at cost-benefit analysis of your intervention, a multisectoral intervention, and comparing it to other sectors. That's what the Ministry of Finance should be doing, right? They ought to be thinking about how to allocate my resources across sectors to maximize social welfare for my country. So that often happens at that higher level. Next, we might go down to cost effectiveness of a very specific intervention or set of interventions to address a particular concern. Vitamin A deficiency, iron deficiency, wasting, severe wasting. And then you might want to, as I mentioned, something about cost effectiveness, you still want to be thinking about what's the cost of introducing and scaling that up. So let's see how this has worked in nutrition. How many of you have seen the Copenhagen Consensus on Benefit Cost Analysis? This was work done by John Hodnott and Sue Horton, and they demonstrated that actually investing in micronutrient deficiencies has a high return on investment. They used benefit cost analysis. Why? Because the Copenhagen Consensus looked at investing across environment, agriculture, education, transport. So the nutrition analysis had to compete, so to speak, or demonstrate its benefits and costs alongside other types of investments. And so they measured the benefits in wage terms. They've got very benefit cost ratios that looked very good, 3 to 5 to 1 or 40 to 7 to 1. What I told you is they have to be positive, and these are positive. They demonstrated very high returns on investments. And in fact, because of Copenhagen Consensus, micronutrient investments became a top priority. Then there's a whole body of literature on looking at cost effectiveness of nutrition interventions. Some of this is in something called the Disease Control Priorities Project, a volume on reproductive, maternal, and child health, where systematic literature reviews were done and demonstrate what these look like for those very effective nutrition interventions. And you can see here micronutrients and deworming are very, the cost per DALY averted is typically less than $1 per person, or the cost is $1 per person, and the cost per DALY averted is low. Behavior change interventions for infant and young child feeding range between $10 and $200, and these have been shown to be cost effective as well. And then in fact, while complementary and therapeutic feeding interventions, treatment of severe acute malnutrition or moderate acute malnutrition are expensive, actually because there's so much death averted with it, they're highly cost effective. So then, then in terms of looking at costs, many of you might be familiar with the World Bank work on investing in nutrition in the nutrition framework. And so they estimated the cost of scaling up a package of 13 interventions, and that work has been quoted and very important for helping to inform policies in many of the countries that we live and work in. So again, how economic evaluations can inform national policies and programs. First, governments have to commit to reducing malnutrition in their national development strategies, and we saw that today in Purnima's policy process. It really starts there, right? But then they need to identify the most cost-effective policies and programs to scale up nationally, and while she didn't spend a lot of time with that, that is what the Ministry of Finance has to try to do, although there are other factors that they take into consideration. And then finally, a cost analysis can help provide a global or national price tag for scaling up cost-effective interventions. So we're going to take a little break here to let you stand up and stretch. I don't know how we're doing for time right now, but if you just a lot of talking, so just take a moment to stretch, stand up, and we're going to switch gears here in just one moment. One way or the other. All right, does anyone have any questions while you're standing and stretching? I know you're being talked at a lot right now, but we're going to make it more interactive in a moment. Okay. Yeah.
Do some of these interventions actually also measure how much of the benefits can be recouped by the government? Because for a government, it's also often it's hard to invest in smallholder farmers because maybe the benefits are very large to them, but because they're subsistence farmers, nothing comes back to the government monetarily.
That's a great question. Economic evaluations have to take a perspective, and so they can take either a societal perspective or actually a provider perspective, or in fact a patient or beneficiary perspective. So you're thinking very much in dollar terms, but as economists, we're really thinking in economic terms. And that means that if small farmers are doing better, they're contributing to national GDP. They're investing in their children, hopefully. They're improving their nutrition and education status. So in fact, we take we would argue that, yeah, the return on investment is not just a financial one, but there's a social return on capital. So that's a great question. But if they really wanted to understand is there an actual reduction in costs, they could look at that. Those are hard to prove. So there's a lot of what's called economic burden, cost of illness or economic burden studies, which say, oh, you can save millions of dollars. Those are advocacy oriented. But to answer your question, we believe that improving the productivity of the population, reducing health and nutrition problems, those do come back in terms of lower medical cost savings. I don't know, Will.
Yeah, one additional point to what Carol just said is that for those of you who might be interested in digging into the policy process and the kind of work that Purnima described, and in response to the experience of the FISP in Malawi and the question of political will, there is a sort of next level cost effectiveness line of work of disaggregating by stakeholder group and thinking about policy processes that have veto power. So a pioneering paper on this for the US medical sector would identify insurance companies, healthcare providers, and patients as separate political interest groups. So if any one of those groups were to have net costs without compensation, they would veto the change. And so it would be impossible to have that occur. So a stakeholder by stakeholder analysis might be interesting for some of you who are ambitious like Purnima and able to sort of really get into the policy process and think about, in your context, who might be the stakeholder groups that could veto a change.
Yeah.
Are there any examples of evaluations that have been done that are directly multisectoral in nature that you can give us? Because the examples provided are more like nutrition specific.
You're stealing my thunder. Yes, we will be getting there. Okay, so if folks can kind of be getting their computers out, I'm gonna just go through a couple of resources online, and then we're gonna do an exercise to get you familiar with sources of information before you even do your research, or to help inform future work that you may be interested in doing. To answer your question, we're going to get there before lunch, and then we're going to work in the afternoon on how to set up such kinds of programs. There's not much out there, though. So what we want to do, what I've sort of presented today might feel a little abstract to some of you, if most of you are nutritionists. We have an economist in the room. Don't know how many other economists we have here, but here are some online resources. What I'm doing is trying to sort of give you a flavor. What we're trying to do is a flavor of what economic evaluation is and how it's been used to date, which is very sector specific. We heard the example from agriculture. You've just pointed out that all of our examples are from nutrition. So we're going to try to move the needle. But it doesn't change the fact that no matter what you're looking at, there are guidance documents out there to help you do it well. And so I want to point out a couple of different types of guidance. One, Tufts University has recently established a global health cost effectiveness registry, but I've checked it and they have nutrition papers in there. So whatever work there has been done on biofortification in terms of a sort of food-based strategy, it's actually in there. Things to affect stunting, anemia, low birth weight, those studies are in there, all right? We're gonna have an exercise on that, and it's really important as you start your own work to read before you do it. So this is a great source. Elena, how many of you are familiar with the World Health Organization's evidence? Elena just added cost effectiveness studies by intervention. So we aren't gonna have time to go through that today, but I encourage you to check that out. It's a great resource. So let's say you're looking at treatment of severe acute malnutrition, you go to that intervention, those papers should be listed under there. It's at the very bottom, of course. They put it always at the very bottom. USAID has just come out with a really nice guidance on how to connect economic evaluations in public health. Now, I know that's in the health sector, but the reality is there are standard methods for doing this, and we can apply them, and we'll show you how to apply them in a multisectoral, but they're really good on the nuts and bolts. And so then there are these things called reference cases. What is a reference case? There are guidance documents out there in the world. There are over 100 different kinds of guidance articles on conducting cost effectiveness analysis and economic analysis. There's no shortage of literature. But what's really important as you start to think about doing your work, and what we're thinking about as we're trying to apply these methods to multisectoral nutrition strategies, is to honor the principles of good research. And so a reference case sets out a set of principles, and Purnima was talking about high-quality research. Reference cases are designed to help us generate high-quality research. So the International Decision Science Initiative, called IDSI, has developed a reference case for conducting economic evaluation in global health and development. And so it sets out principles around transparency. What are the comparators? What is the perspective? What's the measurement of outcomes? Have you clearly described the costs? Have you taken into consideration costs outside of the health sector? Have you dealt with heterogeneity in geographic and socioeconomic and gender class? Have you dealt with uncertainty? Have you thought about the budget constraints? Have you thought about equity? So this is a wonderful reference, an easy to digest document to help familiarize yourself with best practices. The second document, and these are all in our technical working group. The second source is called the Global Health Cost Consortium Reference Case. And this project is coming to an end. I've been the project director of this. It was designed initially for helping improve the use and generation of cost data for HIV and TB. But this reference case for estimating costs is applicable actually to anything, right? And so what's very important is it sets out a set of principles again that is aligned with the steps of conducting a cost analysis. It also provides a checklist in the back. So if you've done any cost analysis in your life, go ahead and check it against this checklist. I had to do that from papers I wrote 15 years ago, and I'm sorry to say that I did not pass, all right? So again, how do we improve the transparency and the quality of our work? We use checklists, okay? And the final, which I think is super exciting, those of you who work in agriculture or WASH or social transfers that aren't satisfied with doing working cost effectiveness analysis, Harvard University has just put out new guidelines and a guidance document, a reference case guidelines on how to do cost benefit analysis and benefit cost analysis. They have a paper for nutrition intervention in Haiti, so one can see how it was done. And it helps us to understand some of those tricky things. How do I value how do I apply a human capital approach to valuing life for global health? How do I deal with those interventions that maybe affect morbidity but not mortality? How do I capture wage, productivity effects into the future? Okay, and they're all consistent. These three reference cases have all been funded by the Bill and Melinda Gates Foundation, and they're all internally consistent. All right, so what we'd like to do now, as I'm going to pass this over to Will, is a hands-on application.
Sorry, I'm doing this wrong. Yep. To quickly scroll down before we lose this. And you wanted all the publication years. Okay. And is this now sorted correctly? Yes. Yeah. Okay. We are in business. So you can see the particular search terms that are used here, and I'll just scroll down to give the total number of studies found and the beginning of the sheet. Okay. So the questions in the sheet: A, what is the total number of studies retrieved in this domain? What do we get as a magnitude of, with these keywords, with these search terms? What do you think of this as a extent of coverage of the literature? Does 28 out of 5,257 seem like a lot or little evidence? Little? 28 is a larger number than 0. It's larger than 1 or 2, but it's a lot less than 5,000. Number of different interventions. Okay. Mm-hmm. And let's look at the first 3. So question C, what interventions are described in the first 3 and last 3 articles? So this is in the league table category, meaning that it's sorted by this incremental cost effectiveness ratio relative to the national level of income per person in the country. As Carol had mentioned, less than the level of GDP per dolly averted. So each entry is a separate country and also a separate intervention, right? So a single study could have many interventions in one country or many countries in one, for one intervention. So the cost effectiveness ratios at the level of $10 per dolly averted for the 4 countries of protein, energy, malnutrition as the outcome, and vitamin A biofortification with sweet potato as the target in all 3 cases. So if you were choosing a biofortification strategy, what sorts, I'm trying to make this smaller so we could see all, so we, yeah. I just wanted to get to comparing these 4 countries with this one intervention and these one outcome, but the 4 different levels of incremental cost effectiveness. Just see if I can shrink the, Okay. So what would be some messaging that you might consider around a result like this top 4? Is that clear? So the observation here is that a single kind of agricultural intervention for nutrition with a single outcome could have 4 different, or in this case actually a tie here, and then 3 different levels of incremental cost effectiveness for the different kind of contexts. If you were advising donors regarding the implications of this, the interpretation of this league table result for interventions, what framing would you offer to this result in communicating Purnima's lesson that any study should have just a single slide, a punchline, a point? What would your interpretation of this result be? Any thoughts on what the punchline of this screen full of data is? So, relative to the criteria that Carol described before our break, what interpretation might you offer to this result, this level of expenditure? Very, very cost effective across all 4 countries. If push comes to shove and you are in some sense absolutely forced to target, you would be moving to these 2. There's no immediate obvious reason to me that jumps out at me why these 2 would be somewhat lower cost per dolly averted than Uganda and Ethiopia, but it's not a big difference.
I was just wondering how the information ends up in this database. Is it something that somebody moderates, or does the author have to submit their data? And how comprehensive is it?
Yeah, we don't seem to have a second microphone anymore. We had a second microphone. So the CEA registry, like ELENA, the WHO registry, extracts these numbers from the studies and offers you a link back to the original study if you wanted sort of richer detail on method and so forth. But the essential idea is to extract comparable outcomes, comparable estimates from each of the studies in the registry and assemble them in a cross-referenced manner. So these results might have been in the abstract of the study, but they might also have been buried, in the text of the study. So they've extracted them from a published paper or gray literature paper that you would link to. So the exercise asks you to jump down to the last 3. Let's do that. So I wanted to keep the headings up there, just to remind us what the headings are. So maybe we'll do not the last 3, but the ones you can see here. Because it does give us enough variation in the actual intervention. So here we're seeing studies that reported, given your question, the title of the study and the first author are listed on the left. So you can see what's coming from the same paper. These 3 are from the same paper. These 2 are from one paper. And then the bottom one is a different paper by the same author. Oh, I'm sorry, back to this first paper again. So they're separated out because there were different interventions. So vitamin A fortification, biofortification in cassava in this first set here, and then biofortification of, in this case, maize here. And then the other intervention, the different kind of intervention, is industrial fortification of, in one case, this row wheat flour, this row maize meal. So anything jump out at you about these levels? Slightly higher than the top of the league table, slightly higher cost. Sorry? Let me jump over, yeah. So I'm just saying that these are higher cost per dolly averted. So it's no longer in the realm of a fancy cup of coffee or a low-cost meal. Now it's in the realm of a cost in the hundreds of dollars, but it's still hundreds of dollars per dolly averted is a very low-cost intervention. So in this data set, even the most high-cost interventions that previous studies have found would be ready targets for advocacy and coalition building to support that intervention. And the most high-cost one is at the $1,200 per dolly. So the general framing questions from our Word document, I'll jump back to that. Ask you to think about the coalition building, the policy dialogue, the use of evidence for advocacy, and an honest broker role between the literature and your particular policymaking community, interpreting this kind of evidence in a careful way, but also for your own research, your own cost-effectiveness studies that you would be doing, making sure that you're able to cite the precedents as well as the reference case that would guide your method to study the particular intervention that you're interested in.
Thanks, Will. So again, just to reiterate, the importance of this is, one, check this and Elena before you do your own work, because this is what you're building off of and you can do better. We can do better, I think. And what you can see is, in fact, there aren't very many studies generating this kind of information. So most of the studies came from a study by J.V. Meenakshi, done several years ago on biofortification. And we just don't have a lot of information. And so what I'd like to do now is actually show you what do we actually know about, sorry, I've got to get the next slide up. Okay. So far, and this isn't going to take long because we don't really have a lot of information here. All right, so up until this point, as I mentioned, we have been sort of focusing on what's available, and what's available is really very much on nutrition-specific interventions, those nutritions from the Lancet series. And so I forget our colleague, our friend's name up front, who asked about, well, will there be any evidence from multisectoral nutrition strategies? So what I'd like to share with you is actually a recent sort of systematic review that was done for the African Development Bank. African Development Bank is interested in maximizing their investments across sectors to improve nutrition. So they have developed a strategy. Excellent. So we conducted a review of economic evidence across the sectors that the African Development Bank works in and that many of us know contribute to improved nutrition, to look at what do we know about what's effective. And then we expanded this review just recently to say, does the intervention have any cost data? Does the intervention have any evidence of cost effectiveness? And has there been any attempt to demonstrate the economic outcomes like improved GDP or labor productivity or income? So very quickly, these are the nutrition interventions in health that work across the life course, and these are from the Lancet Commission predominantly. What's in orange are studies that show evidence on nutrition outcomes. What's in a brighter orange is if there's an intermediate outcome. such as, what is an intermediate outcome, dietary diversity, dietary intake, food security, right? And then the little black dollar sign is if there's information on costs. The little green one, again, is on cost effectiveness, and the little bag of money, of course, is on economic outcomes. So what you can see in this body of literature from the health sector is we have pretty good data on effectiveness, not bad data on costs, not bad data on cost effectiveness, all right? But now let's go to those agricultural interventions that are known to improve nutrition across the sort of farm to fork value chain. And these are interventions that we care about a lot. We talk about them a lot. But as you can see, where do we have the evidence? Evidence of effectiveness is predominantly in mass fortification, some food safety, biofortification, home gardening, price policies, some information on price policies, aquaculture, household and extension work with behavior change communication. But look at the information, look at the green icon. That's the icon for if we have information on cost effectiveness. So to your question earlier about how many studies do we have on multisectoral strategies, for agriculture, not a lot. And so that's a gap. Let's go ahead and let's take it down to water, sanitation, hygiene. All right, so we know that we're getting improved information on effectiveness through the SHINE and other studies that have been supported recently, but we have very little information. Again, we have some information on cost, but very little information on cost effectiveness and on economic outcomes. And lastly, on social protection, there's been a lot of us work in the role of cash transfers, conditional and unconditional cash transfers, livelihood and safety nets. And again, we have information on what works, both for direct nutrition outcomes and intermediate, but we really don't have a lot. We have a lot on cost, fortunately, but not a lot on cost effectiveness. So this is where the literature is, this is where we are with the literature on multisectoral nutrition strategies. So for today, when you get your slides, you're going to have access to what do we know about cost effectiveness of direct nutrition interventions and these that are across sectors. So if I could, I need to switch back to the other presentation, if I can get some support. I don't know where our text. Can I switch slides? So what we're going to do now, and this is before lunch, so I'm going to ask you to hang in there with me because this, sadly, might be the most interesting and important part of, what time do we have? Well, sorry, I don't have a, oh, perfect. So in the remaining half hour before lunch,